Good evening. My name is Latoya Gilliard. Today I will be discussing the importance of the care and treatment of HIV and AIDS. At the age, what you will learn today: what is HIV, what is AIDS, symptoms of HIV, stages of HIV, symptoms of AIDS, and treatment and care. I'm gonna stop right there. So, um, my grandmother, at the age of 56, died of HIV and AIDS. She found out at the last minute, and when she did, she didn't want to live with that anymore. She started taking treatment, but she did not want to live anymore. So, that's why this is the importance of care and treatment of HIV and AIDS. You have to catch it at an early sign. With regular testing, you can catch it. Okay. What is HIV? Also called human immunodeficiency virus. HIV damages the immune system and interferes with the body's ability to fight the infection and disease. HIV can be spread through contact with infected blood, semen, or vaginal fluids by blood products, unclean needles, or unscreened blood, by having unprotected vaginal, anal, or oral sex, by mother to baby, by pregnancy, labor, or nursing. There is no cure for HIV, but medications can control the infection and prevent disease progression. So we have HIV symptoms: fever, chills, rash, night, sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, mouth ulcers. So there are three stages of HIV. Stage 1, acute HIV infection. Stage 2, clinical latency. Stage 3, AIDS. What is AIDS? Acquired immune deficiency syndrome. AIDS is a chronic, potentially life-threatening condition caused by a human immunodeficiency virus, HIV. By damaging your immune system, HIV interferes with your body's ability to fight off the infection and disease. So, my grandmother, she got HIV, and then it turned to AIDS. And the reason why it turned to AIDS because she didn't take the treatment and didn't seek attention with treatment before it had got to that stage. And by the time she started taking treatment for it, it had already developed into the stage of AIDS, which is stage 3. And she didn't want to live anymore. But by taking medication, you can live a long and healthier life, you know. With the right treatment and care, people with HIV can live a normal lifespan. People who have a good response to HIV treatment have excellent long-term prospects. You can increase your life expectancy by not smoking and having a healthy lifestyle. AIDS symptoms. Symptoms of AIDS are caused by deterioration of the immune system and the decline of CD4 T cells, which are the immune system's key infection fighters. As soon as HIV enters the body, it begins to destroy these cells. Some common symptoms include diarrhea that lasts for more than a week, dry cough, memory loss, depression, neurological disorders, pneumonia, or unusual blemishes on the tongue, in the mouth, or in the throat. Profound unexplained fatigue, rapid weight loss, recurring fever or profuse night sweats, red, brown, pink, or purplish blotches on or under the skin, inside the mouth, nose, or eyelids. Swollen lip glands in the armpits, groin, and or neck. White spots. Treatment and care. What is HIV treatment? HIV treatment is antiretroviral therapy, or ART, involves taking medicine as prescribed by a healthcare provider. So, we're fortunate enough to living in the United States to get treatment and be able to receive that treatment and care, whereas other countries can't receive this treatment and care. HIV treatment reduces the amount of HIV in body and helps you stay healthy. There is no cure that exists for HIV and AIDS, but medications can control HIV and prevent disease progression. So if you take your medication, it is no cure, but it will slow down the process of deteriorating your body. With treatment, most people with HIV in the U.S. don't develop AIDS. So with that being said, if you take your treatment, it will not. Most people it won't develop into that stage 3, which is AIDS. HIV antiviral suppresses HIV slow progression of infection and reduces the risk of infecting others. In conclusion today, so what we have learned and gathered from everything today, get tested. Go to the doctor for your checkups. Get tested. If you have any of those symptoms, go to the doctor. Get tested. And you don't just get tested one time. You have to go regularly. Every year, get tested if you are experiencing those symptoms. Know your status. Know your status. Know your status. If you know your status, then you know what to do to help yourself live long and healthier lives. There is no cure for HIV, but treatment HIV medicines called antiretroviral therapy, or ART, can slow or prevent HIV from advancing from one stage to the next. Treating people living with HIV earlier in their life infection dramatically reduces the risk of transmitting the virus to others, underscoring the importance of HIV. The sooner you talk with your children about HIV and AIDS, the more they will be able to make healthier choices about sex and drugs. Help them make healthier choices to protect themselves for life. So, thank you for giving me the time to discuss with you the importance of getting care and treatment of HIV and AIDS. And I wish that my grandmother could have caught this before it was too late, because right now I'm without a grandmother and I love her dearly. And just like you will want to have your loved ones here with you as long as they can be. And if getting treatment and care from a doctor helps that person live longer, then by all means, we should do that. Help. Go to the doctor. Get tested. Yes. I am Latoya Gilliard. Have a great night.